Right now, 37 million Americans are suffering from chronic kidney disease, and unfortunately, 90% of them had no idea. Your doctor gives you a simple blood test and your creatinine looks normal. They tell you you're fine, and you leave the clinic feeling relieved. Unfortunately, what many people in America don't know is that by the time standard tests show kidney damage, you've already lost over 60% of your kidney function. 60% is gone before a single red flag appears in your medical record. There are kidney patients in America who come to my clinic feeling completely fine. But when we check the GFR, or glomerular filtration rate, which is the number we use to measure kidney function, unfortunately, some of them had a GFR of 38. This means they're in stage 3 of kidney failure, having lost over 60% of their function without knowing it or feeling any symptoms. If you have diabetes or high blood pressure and take a lot of painkillers regularly for any reason, pain or chronic illness, this video is very important for you. Your risk isn't theoretical, your risk is real. So why does this happen? Why do 90% of kidney patients go undiagnosed? The answer isn't that your doctor is incompetent, but the tools we've used for over 50 years aren't designed to detect kidney disease early. For example, a standard creatinine test doesn't show high levels until the kidney is significantly affected. It's like a fire alarm that unfortunately doesn't go off until the whole building is on fire. This isn't a failure of medicine, but a failure of the old technology we were using. And that's exactly what artificial intelligence is here to fix. In a bit, I'll show you exactly how we use AI. But first, let me explain what AI is, simply, and what it can offer you regarding your health, for better or worse. Your kidneys don't hurt when they start to fail. That's what makes kidney disease so dangerous. Unlike your heart, which sends warning signs like chest pain or shortness of breath, the kidney remains completely silent. Kidney disease has 5 stages. A patient could be in stage 2 or 3, losing function every day while feeling perfectly normal. I'm Dr. Osama Ibrahim, a specialist in nephrology and dialysis. In this video, I'll show you how artificial intelligence is changing healthcare for all patients, especially those with kidney disease, and what it means for the future of your own kidneys. When people hear about AI, they immediately think of robots in science fiction movies, something that will replace doctors, like a robot taking the doctor's place. And the truth is, that doesn't happen in medicine. A nephrologist like me can analyze your creatinine trends, protein levels, and blood pressure history, and I can identify patterns. But I can only process a limited amount of data in my mind at once. AI here looks at thousands of variables all at once. Your lab results over a 3-year period, medication history, your imaging scans. It identifies patterns invisible to the human eye. AI doesn't diagnose you, but it alerts us as doctors. Look here, review this analysis. There's a high indicator here before it's too late. In 2019, researchers at the Massachusetts Institute used AI to analyze 6,000 patients. AI predicted kidney failure with 90% accuracy 2 full years before clinical diagnosis. 2 full years are the difference between stage 3 and stage 5. The difference between medication and dialysis. At Mayo Clinic, there are many AI tools now analyzing kidney ultrasounds and identifying structural changes that top radiologists classify as normal. Small scars, slight changes in the blood vessels, things that could develop years before you even feel them. But it's very difficult for human doctors to notice them accurately. Some hospital systems in America are now running AI in the background of every patient's file. If your results start looking dangerous, the AI sends an immediate alert to your doctor before they even notice the change. And this isn't just theoretical talk. As nephrologists and dialysis doctors, we use AI daily as a tool to help with daily patient monitoring. For example, in dialysis patients, one of the most dangerous problems that can happen is a blockage in the arterial or venous access created for dialysis. Of course, it's checked before every dialysis session by doctors and nursing staff. The problem is that this blockage sometimes starts with minor things and subtle symptoms that aren't clear at first. What's different now is that the AI systems we use can read all the data from the dialysis machine itself, like pressures, flow, arterial pressure, and venous pressure regarding the arterial access, and notice any small changes in performance. These changes might not be noticeable to the doctor or nursing staff at first, but the AI issues an early warning. In other words, AI here isn't replacing the doctor, but it gives us an early warning that saves the access and the patient, and then the decision's up to the doctor, not the AI. AI is nothing more than a powerful assistant, but here is the most important group: the patient who passes all the standard tests. Normal creatinine, normal blood pressure, no protein in the urine. The only thing that revealed their decline was an AI system tracking something new called microscopic changes in their tests over 18 months that no human could notice. If you're over 50, you might be one of those patients right now. Now, I have to be very honest with you. AI is not a substitute for a nephrologist or any doctor. I can't examine you clinically. It can't see the swelling in your hands, under your eyes, or in your ankles, which are the symptoms that appear at the onset of kidney failure. It also can't feel the fatigue you suffer from every day that persists for no reason. By the way, we made a special video about the most common symptoms for kidney failure patients in America. I'll leave the video link in the description or in the iCard. So AI is a tool, the most powerful tool medicine and all other fields have gained in the last 50 years. Its job is that it can collect a lot of data that a doctor can't collect, and it links this data together and gives an early warning to the doctor to focus on certain things. But in the end, it remains a tool that can't examine you clinically. It can't feel the emotions and things you report to your doctor, because all these factors contribute to an accurate diagnosis of your condition. So, doctor, what should I do with this information? Does that mean I shouldn't use AI? Shouldn't I ask ChatGPT or Claude or anything about my health status? Let me tell you what I say to my patients when they ask me this question. Step 1, know your starting point. Ask the doctor you're following up with for a comprehensive analysis for yourself, including creatinine, urea, GFR, and the urine albumin to creatinine ratio. Step 2, track the trends, not just the numbers. Watch the numbers over a month, not just today's result. After that, you can use any AI tool and input this data, and it'll give you a general overview. If you want to know the most popular tools or sites where you can put this data and get a good result, leave me a comment and I'll recommend a set of tools that will give you accurate tracking of your lab results. Thirdly, ask about smart monitoring. Ask the doctor you're seeing if their system uses smart alert tools to monitor kidney function. Step 4, and the most important step, don't wait for symptoms. I've said it and I'll say it again. Kidney disease is unfortunately a silent disease. The appearance of symptoms means a very significant decline in kidney health. I advise you to watch the video series appearing above on the screen related to this topic. It's very important for you. Medicine is now at a turning point. For the first time in history, we have tools that can see kidney disease as it forms before your body sends a single signal. And this isn't science fiction. It's happening right now in hospitals around the world. The most powerful thing you can do is not wait for AI to find you in the hospital, but to go immediately for a checkup today before you feel anything is wrong. I'm Dr. Osama Ibrahim. This video helped you understand something simple your doctor didn't explain to you? Share it with someone else who might need to hear it. And don't forget, we made this video for you today with good intentions. We also hope you've done something good today. Always make it a habit to like, share, and benefit others. I'll see you next week to check on you and reassure you. Don't forget to watch the previous videos. They'll help you.